The following podcast is taken from a live broadcast on Inspire FM.
Any health advice given, whether general, diet, physical or spiritual, is general only and must be verified by your doctor. If you need medical advice, please consult a doctor.
Assalamu alaikum to all the listeners and viewers. I welcome you all to another exciting and educating edition of the Health and Fitness Show. I'm your host Fahad Matin for today's show, and I hope and pray that all of us are fit and healthy by the grace of Almighty Allah. This show is broadcasting from the studios of Inspire FM on 9th of January 2020. Yes, indeed, we are in 2020 and casting all its positive vibes to all our lovely people in Luton and the surrounding areas of Luton like Dunstable, Harpenden and Bedford. And our airwaves reaching all over everywhere, across our Facebook page and across our web app, and then definitely it seems like our video is not up and running on Facebook for some bizarre reason, but yeah, we will be up and running pretty soon. Oh yes, we are up and running. Sorry, it seems like the technology sometimes baffle me as well. So as we all know that we do a different topics every single week, and we try to highlight whatever going on in the community, because one of our main motto of this show is to provide necessary information to all our lovely people in Luton and all the surrounding areas of Luton like Dunstable, Harpenden and Bedford. So and definitely going all over our areas are going through Facebook via link as well. So I normally, as this is the second show of this new year, I thought why not we do a quick catch up on something which is a problem in some areas, and definitely the topic for today is a very unique one, because we had touch on that last year as well, a few weeks ago. And that the topic was lung health check. Yes, so the topic for today is lungs health check. And as we all know, I'm not the person who talk about these topics. I'm the guy who normally asks questions, because I have lovely guests every single time in the studios. And today's another very good day, because I have our very own residential doctor who is with me in the studio. He's a legend. He's my GP, and he's GP of more to many of our listeners as well. And definitely, he's always an inspiring figure for me, because he always guided me, educated me in different ways. But other than that, he is a brilliant personality. He's also the Luton Clinical Commissioning Group's respiratory clinical lead as well, and he is none other than Dr Talib Abu Bakr. Assalamu alaikum, sir.
Maalaikum.
How are you?
A big introduction there.
Yes, well, you are inspiration for me, and I must say you inspire me in many different ways. So,
thank you for that. Thank you for those kind words.
I always look up to you in many different ways, because you always encourage me, motivate me, and make me happy.
Excellent. We try our best.
Indeed, indeed. How are you, sir?
Very good, thank you.
Although I have said so many words, but still the introduction is required from our guests. So a quick intro for our listeners.
Well, I'm a GP, work full-time at Bell House Medical Centre in Bury Park. Have been there since 1995, so just over 24 years. I get inspired by my patients. There's some amazing people out there who are doing amazing things. Unfortunately, illness happens to some of us. Sometimes we make illnesses happen. But how people change their lifestyles and their way of life to try and improve themselves is quite inspiring. And you learn those stories, then you pass them on to other people to see if some others will take that on board.
Yes, indeed.
And I think Luton's a fantastic example because there's amazing people who've taken things on and just run with it, literally. Have done some amazing things to their health, but has a knock-on effect on family members, friends, and so forth.
And yes, I know, because there's so many new things started via Luton, and I think so. The health check, the lung health check, is one of them, which is part of Luton is one of the pilot projects. I remember.
Well, we didn't start it. Leeds and Manchester were the first original pilots, but because their studies were so good, another 10 to 14 other areas were also picked to pilot it, and Luton is one of those.
So I remember you mentioned about this last time, and you said this is one of those things which it's unique in many different ways, but then it also bring Luton in a different light, because it will allow people who have problems in the past smoking, if they used to smoke. So please give
just to recap of what the project's all about. We were hoping to start by now, but certain contractual things and so forth, which is beyond my control and way above me, because I'm not really management. I'm clinical. What the plan is, everyone who is over the age of 55 and up to 75 as part of the pilot. So unfortunately, we can't take people outside those age groups who've ever smoked or smoke now will be offered over the next 2 years. So it's not something that the practices are going to be able to do now, and hopefully we can take it away from the practices. So the practices are definitely involved, but it's a separate team altogether. They'll be contacting these people by letter over the next 2 years, hopefully starting March, April time. And if you're in that risk group, you'll be given a health check of your lungs, and that would involve a questionnaire to see how your lungs are working, how many cigarettes you smoke, whether you're still smoking, how far you can walk, and your general questions about breathlessness and so forth. And then you'll be offered a spirometry as well, which is to check your lung capacity, is a simple way of looking at it. And those at the higher group will be offered a CT scan, which at present they don't get. And it's a low emission CT scan, and what the results are showing in Manchester and Leeds and co is that those who are at the highest risk, and we do a CT scan, a small percentage of them are showing up with lung cancer at a very early stage. So stage 1, which potentially is curable. Whereas a lot of people at the moment without this project is being picked up at stage 3 and 4, which is much more difficult to treat.
Because in the cancers, lung cancer and pancreatic cancers are the worst ones.
Well, there's lots of cancers. I qualified in 91, and if you had cancer, there's very few cancers that you could cure. Well, nowadays, for example, breast cancer. If you had breast cancer when I started as a junior doctor, most didn't survive 1 year, but now most are surviving 5 years plus, and we're getting cure rates. So medicines in oncology has changed dramatically, and we're far better at treating these conditions. I would like to add, and I'm sure we'll touch on it later, but prevention is still better than cure.
Indeed.
And there's lots what we could do out in the community, and people ourselves, individually, as families, as communities, to try and stop getting cancer in the first place. But treatment rates are improving. Lung seems to have lagged behind because it's a very difficult cancer to pick up and treat, and very much like pancreatic cancer, it gives you symptoms later on. So the idea is to try and prevent it, and the number one thing you can do to prevent it is to stop smoking, or not start at all. But certainly stopping smoking will make a massive difference, and there's lots of things we can offer in the community and your practices on how to help you stop smoking. And unfortunately, if you have smoked or still smoking and you fit into that age group, we will be offering you these screening tests. And don't forget, majority of people aren't going to be picked up with cancer. The idea is to tell you about lung health and learn about it. Secondly, it's to pick up any other conditions like asthma, COPD, interstitial lung disease, and then a smaller percentage, I think, out of all the ones they screened in Manchester, an extra 100 cancers were picked up at an earlier stage than they would have normally.
Extra 100?
Yeah.
Wow.
So these people would have got cancer anyway, but they would have been picked up at a later stage, 2 or 3 years, when their symptoms would have got worse. So now, as I say, we're very fortunate that we've been picked, partly because we were high in smoking rates and also survival rates for lung cancer, because people were presenting at a later stage. So now with this opportunity, we're hoping that we can screen that age group. The sad thing about the pilot back in Manchester and Leeds was only 50% attended for screening, even though they were invited with at least 2 letters. So that's not an unusual figure for screening in this country.
Yeah,
and unfortunately in Luton we seem to do worse for other types of screening, like cervical screening, bowel screening and breast screening. So we're using this as an opportunity not just to advertise the lungs side for the 55 to 75 year olds, but also to keep encouraging people. If you see that letter drop on your mat, screening does save lives. So, you know, breast cancer, bowel cancer, I've at least 2 in the last 3 months of my patients who've been picked up at a very early stage because of screening, and they're cured. They have their treatment and they're cured, or potentially cured. They'll know in 5 years' time. But otherwise, these people have been picked up at a much later stage, which is more complicated treatment, more complicated surgery, and the screening helps reduce that.
On that note, let me introduce us listeners as well, our listeners. So let's see what they can say. So listeners, if you have any questions or queries regarding our topic tonight, please get in touch with us by either calling us on 01582 481822. I repeat, 01582 481822, or you can send your questions via text messages or WhatsApp on 07779 481822. Now, I do have one question pop on my screen, sir, and it says, Assalamu alaikum. Please explain what is a low-level CT scan, also why it's over 55.
So the risk of lung cancer is, on the whole, majority of people are over 55. So it doesn't mean that if you have symptoms of a persistent cough more than 4 to 6 weeks is what I normally say. The government advertising is saying 3 weeks. But if you're a smoker and you've got a persistent cough that doesn't go away after a number of weeks, or you cough up blood, or you're getting more and more short of breath and it's been a sudden change, you should still be seeing your GP. So just because this pilot scheme's going on, if you're still worried and you're 45 or you're 85 and you're outside those risk groups, you still have to go through the process of what you would do now, even when the pilot's not there. That's his first port of call, is to see your doctors, and they will do the various tests and investigations and discuss with you what the next step are, and they can still refer you through what we call the 2-week wait if they worried that there's cancer. So that doesn't change, and that's made big differences in people's lives already. This is extra, it's still a pilot, so we can't offer it to everyone. And when you run pilots, to see what's the best approach, you have to set limits. And what the studies have shown is 55 to 75 is where you'll pick up most of them. So as I say, we are still encouraging. That's why we called it lung health rather than screening, is to highlight to the community of the symptoms they should be looking out for to see their own doctors. So it doesn't necessarily mean if you don't fit into that group, that you don't seek help. You still need to seek help, even if you fit into that group, because it might be a year down the road when you get your letter for an invite for the screening. And it's the same with breast lumps, breast screening and bowel screening. If you still get symptoms of bleeding bowels, for example, or you're changing bowel habit that lasts for more than 6 weeks, or you're suddenly losing weight for no reason, you still need to go and see your doctor to be assessed. Sometimes, most of the time, it's benign conditions, but there's also the sinister conditions like cancer that we would need to watch out for. So that's when your GP will ask you specific questions, do specific investigations, and refer appropriately. So again, this has given us an opportunity to things like this, get on air and advise people not just about the scary word of cancer, but actually how to look after your health to prevent you getting that in the first place. Indeed. And also to look out for signs early on so that we can pick up things early. And you might find it's other conditions that we wouldn't have picked up because you didn't come to the doctors because you've got the symptoms.
Now, this basically pilot is specifically targeting smokers.
Yes.
So that's just a cigarette smokers, or it can be shisha smoker, or it can be cigar smokers.
Well, at the moment, again, the pilot, because it's a pilot, it has to be very specific, because you've got to be able to compare like for like across the country. So at the moment, we're looking at cigarette smokers. Okay.
In terms of lungs, as you said, that certain medications can, if you've been highlighted that you're on stage 1, certain medications can help you cure the lung cancer. So in terms of general health of lung itself, I know you have mentioned in past programs that a person's lung has more age, and yes, the amount of damage we do can be reversed, but then you have to do certain measures. I completely forgot about specific words, but you mentioned about the lung health in general in terms of how much age of the lung normally varies.
Yeah. Firstly, for lung cancer, the mainstay of treatment is surgery. So again, if the tumour is very small, it's much more amenable for surgery. Whereas if it's much larger, then it starts to affect other organs, and your heart and major blood vessels are very close to it. Then it makes surgery much more complicated or almost impossible. So that's why surgery is the mainstay. Chemotherapy is second line if it's appropriate. So it's normally surgery, and depends on what type of cancer as well. So you can get types of lung cancer which are lymphomas, which technically aren't lung cancer, but they first picked up in the lungs. They're much more amenable to chemo. But the majority of lung cancers, you're looking at surgery as the mainstay of treatment. So just to correct you on that point. Lung health is the same as living healthy. There's no difference. It's about eating well, exercising, breathing. You can do without water for a few days, you can do without food for a couple of weeks, but you can't do without oxygen for a few seconds for most of us, a few minutes for the world record holders. But we have to have oxygen, and the way we get oxygen is through our lungs. So we've got to look after our lungs, and our lungs are these two large balloon-like structures, but they're made up of tiny, tiny little bubbles, because that increases the surface area. And if anyone remembers physics, which I have forgotten more physics than I've learnt, but the smaller the area, the bigger the surface area. So your lungs are like little, if you know the chocolate bar, Aero bars, it's got lots of tiny, tiny little bubbles. Well, each one of those bubbles has a blood vessel, which then exchanges oxygen. The more of those you've got, the healthier lungs and the more oxygen your body gets. And oxygen's good for all sorts of things.
Exactly.
Now, if you don't look after your lungs, the lungs, if you're overweight, for example, your lungs don't get a chance to fully expand, so you're not getting the full amount of oxygen that you need. So, if you've got a slightly big tummy, like I have over the holiday period, it's reducing the amount of space left for my lung to expand. So I am already taking less oxygen. If I'm not breathing correctly, if I'm not using my diaphragm properly, I'm taking less oxygen. So some studies have suggested 10 to 15% less oxygen just by the fact our posture. For example, if you're slumped in a chair, again, your diaphragm's not working properly. So just by sitting up straight, taking deep breaths, making sure when you take a deep breath your stomach's coming out rather than going up. Most people do it the other way around. So, for example, if you take a deep breath in, if everyone
tuck their stomach inside.
Well, exactly. Yeah. So if everyone at home takes a deep breath in now, most of us will suck our stomach in.
Yeah.
If you imagine if you stuck your stomach in, the diaphragm can't come down, which means that you're not getting the full volume of your lungs. So these simple exercises that you can do, if you just go onto YouTube and look up breathing exercises or relaxing breathing exercises, you can breathe much more efficiently than you could do. And even those people with lung illnesses like COPD and asthma, if they start doing these breathing exercises, they do improve their lung. Although it's not a muscle, it works like a muscle. The more you work it, the better you work at it, the more efficient it becomes. But going back to those little bubbles, if you smoke, for example, as an aging process, as I get older, those bubbles are slowly popping. So mine's going pop, 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 very slowly over a period of time. If you're a smoker, that popping is happening 5 times faster than naturally. So instead of going pop, pop, there's going and you don't get those
bubbles back.
Fortunately, nature's giving us much more than we ever need, but it hasn't given us 5 times more, because as a smoker your lungs are shrinking 5 times faster than mine. So the size of the lung isn't shrinking, but the surface area is shrinking. And that dead space that's left behind, the body doesn't like dead space, so it fills it up with mucus, which is full of nice stuff for bacteria. So your risk of getting infections much more. Your lungs aren't expanding as much. Your oxygen levels aren't as high as they should be, because you can't exchange the oxygen because that part of the lung has less surface area. So you can see how slowly your shortness of breath starts. The mucus starts to build up, so you develop a chronic cough because your body's constantly trying to cough up this phlegm. You start to get infections more frequently, so that starts to increase the amount of antibiotics you have. Then they start to become resistant to that. And every time you have a chest infection and pneumonia, particularly for people with COPD, you lose even more part of that, the alveoli. So then it becomes a bit of a vicious cycle. So we try and reverse that cycle by getting them to breathe properly and stop smoking. I know I sound like a parrot every time I come here. I think I'm talking about stop smoking, but the number of people I still see who are kidding themselves when they say, I only smoke a little bit.
Yeah, that's what I wanted to ask. What's the difference between the people who are smoking like 10 cigarettes or 20 cigarettes than a person who's having 5 cigarettes or something a day?
The number of cigarettes you smoke per day, so if you're smoking 5 a day, that means in a week you're smoking 35. So in a month it's over 100. Okay? That's a lot of cigarettes. We can't visualize in a radio station, but we've got this little cube with how much 20 cigarettes, how much fluid is left in your lungs, of which at least 40 causes cancer. Most of it your body doesn't like. So I always think of my body immune system like an army. For your army to work properly, it has to have oxygen, has to be fed properly, and it has to exercise. If you got an army that never exercises, it's not much good as an army. If you don't feed that army properly, with healthy foods, it's not going to be a very effective army. And if you don't give it oxygen properly, it's not going to be very effective either. Well, that immune system, your army that's in your body, is designed to fight off infection. It's designed to heal things, fix things, reproduce things that are broken in your body. And also it's there partly to stop cancers happening. Your macrophages and things like that, they eat up cancer cells at early stage. Well, if your army is busy looking after your smoking or looking after that extra food that it doesn't need, your army A is being distracted, but it's also not very fit because you're not allowing exercising that army. Things come in through the back door. So we increase our infection rates, we start to get illnesses that we shouldn't be seeing, and also cancer comes in through the back door. So So by thinking of it like an army, what would you expect an army to look after you look like? It needs to be fit. It needs to be healthy. Well, that's what our body should be. So we should be eating better. We should be exercising regularly. We should be watching our weight. We should be mentally alert and happy and stress-free. So what are we doing to help those things? And there's lots of things that people could be doing in a natural way, not just relying on medication. And certainly that's a lot of things that, certainly from the social services point of view, Luton CCG point of view, and a big part from the community itself, is pushing people to start looking after themselves rather than just relying on quick fixes of tablets and so forth.
And definitely, I must say, the contribution you do in terms of the park runs and so forth, and motivate people, including myself, to do park run is amazing.
Well, it's because I see people do it and they motivate me, and I can't stop talking about it because I see people changing, and because you see people change, you change yourself, and then you just encourage other people to do it.
Indeed.
And it's amazing.
Exactly. And I really, first day I was like, seriously, how can we run that long? But after doing that, I really enjoyed it. And on that note, wow, the time has passed really, really quickly. I've just scratched the surface. There's so many things I need to ask, and there are a couple of questions on the section as well. But I will ask all those things when we come back from our break. So it will be a very quick, short break. So when we come back from break, we will talk about, as the weather is changing, so we will talk about infections and especially the emergency medicines as well. Stay tuned.
Assalamu alaikum, this is Atif Nawaz. Listen to Inspire FM shows in your time by heading over to inspirefm.org or listen on Apple Podcasts or Spotify.
Any health advice given, whether general, diet, physical, or spiritual, is general only and must be verified by your doctor. If you need medical advice, please consult a doctor.
Assalamu alaikum and good evening to all our listeners and viewers. I welcome you back to the Health and Fitness Show. I'm your host Fahad Matin for today's evening, and we are talking about healthy lung and lung health check with our very own guest, Dr. Talib Abu Bakr. Assalamu alaikum, sir.
Walaikum salam. How are you?
Alhamdulillah. This program is broadcasting live from the studios of Inspire FM today on 9th of January 2020. And casting our positive vibes to all our lovely people in Luton and the surrounding areas of Luton like Dunstable, Harpenden and Bedford. Milton Keynes as well. And you can hear us or view us via Facebook page as well. All you have to do is just go to your Facebook page and click Inspire FM live link, and you can view us. So before we went on break, we were talking about lung health check, and Doc was just giving us insight in terms of how our lungs, which is a beautiful apprentice made by Almighty, help us. And although they have a very big life, they have good capacity, but how we destroy them by doing smoke and so forth, isn't it, sir?
That's right, yeah.
So I do wanted to ask you, and definitely one of our listeners did post a question. So before winding it up, I just need a couple of things which I need to highlight it on. I want to ask you, or our listeners want to ask you, does e-cigarette cause damage to the lungs?
Your lungs are really paper thin, okay? So it's not designed to have things going into it. But the cigarettes, nicotine, and everything in cigarettes, not just nicotine, there's all sorts of things, formaldehyde, coal tar, everything. In fact, there's more different chemicals in cigarettes than there is in exhaust of a car. It's just the volumes are different. So I often joke with people is you may as well stand there and go to the car and have a nice suck of the car exhaust rather than a cigarette. It's probably healthier.
Old car exhaust,
Probably-
not the new one.
Probably quite. It's not true, but the actual different chemicals is much higher in cigarette smokings, and 40 causes cancer.
Wow.
E-cigarettes on the whole has just nicotine. Okay, it's still early days. Originally it was thought to be super safe and no problems whatsoever, but there have been some deaths in America. There have been some issues with lung infections in this country as well, so it's not 100%. So but the numbers are far less than what's caused by lung cancer. Lung cancer is huge. Heart disease is huge. We have over 350,000 people die a year. A lot of it's cigarette smoking related. So the worst figures are for cigarette smoking. So I always think of it like if I drive my car on the motorway, I think I've explained this one to you before, 70 miles per hour, I can follow all the rules, do everything right, and there's still no guarantee I'm not going to have an accident. As a cigarette smoker, you're driving your car 5 times faster than me. So that means you're driving your car at 350 miles per hour. So that's more chance, the highest risk of having any accidents, heart attack, strokes and what have you, is much higher. If you follow all the rules and don't smoke, look after your health, there is still a small chance you might have an accident, but it's a much smaller chance than if you're a smoker. An e-cigarette, I always, and we don't have the figures, but I would suggest it's like driving a car 90, 100 miles per hour. So it's still not as good as driving at 70 miles per hour, but it's still far better than smoking. So if you've gone to Luton Total Wellbeing to get your smoke cessation advice and patches and nicotine replacements, or you go into your practice, some practices will offer the same services, and you find and you've tried and can't manage, e-cigarettes is still a good way to start to reduce your cigarette intake. The problem we're finding now is people come off their cigarettes and going on to e-cigarettes instead, but staying on it. They're not addicted, they just stay on it. It's a habit. And what they should be thinking is, okay, I'll use the e-cigarettes to wean off the cigarettes and then slowly come off the e-cigarettes itself. The worrying thing for me is youngsters are now thinking it's quite cool and they're going straight onto the e-cigarettes. They're not even smokers yet, they're going onto e-cigarettes because they think it's completely safe. Although it's not, it's still more dangerous to get into a car than it is with e-cigarettes. It's still early stages, so I would say to people that if you're really struggling with cigarette smoking, e-cigarettes is a fantastic way of reducing your smoking, but it's not. You don't want to be thinking it's completely safe. I don't want youngsters to go on to e-cigarettes because it's a safe and it looks cool. Yeah,
I remember you gave an analogy on that e-cigarettes like you just putting your mouth on a kettle who's just boiling through. You just literally take.
It's heat. Yeah. A kettle is just water where we inhale and exhale water all the time, but not hot water. So steam will damage your lungs. So e-cigarettes will have some effect, and that's why we're seeing some of the conditions that we're seeing. But the numbers are still very small compared to smoking. And we've known about smoking for years and years and years, and yet people are still smoking. And the worrying thing for me is the younger age group, particularly young ladies, are the main group that were growing. Fortunately, I think Luton the numbers are going down and we're doing really well. So the services that are out there with Total Wellbeing is working. The practices that run smoke cessation clinics is working. When people go onto these smoke cessation clinics, their success rates far outweighs than someone trying to do it on their own. So that extra bit of help, the extra bit of coaching really does make a difference, in addition to whatever they give you, patches, chewing gum, inhalators, or even e-cigarettes. So do join a group, join the smoke cessation team, because their success rates are really good, and it's the start of the year. What better way to start the year by actually committing yourself? I still remember my dad used to be a smoker, and I still remember that phone call when he had his heart attack at 55 and he was admitted to hospital, and I was coming back from school and we had to hear that news that he was in hospital with a heart attack, and we didn't know if he was going to survive or not. I was 14, and still to this day I remember. And I have to say to some of my patients who blindly go on smoking, your child is going to have to face that same phone call at some stage. And 60% of people who have their heart attack die with their first heart attack. My father was very fortunate. He didn't. He changed his life around. He stopped smoking. He ate healthy, walked everywhere, and fortunately lived to 83, 84, even though he's had his heart attack at 55. So it can reverse this if you start to look after yourself.
In terms of reversing, so if somebody who is a smoker and they give up smoking now, although the damage has been done, so they are somewhere around late 40s, early 50s, somewhere around that category who will be qualifying for the CT scan. Health scan. If they stop, the damage has already done to the to lungs, but can it be survive, or can the damage be reversed?
Because the lungs are so big, you've got so much more lung than you need. The reversibility doesn't happen, but what lung you've got works very well. So you can do everything you want to, as long as you stop smoking, because the damage keeps going. So that analogy I gave you with the bubble wrap, just popping away, well, every puff, it's not every cigarette, every puff of cigarette you have, you're losing 5 times more alveolar than I am. You don't have 5 times bigger lungs than I have. So eventually, we encourage people to stop smoking at any stage. So even an 80-year-old who's struggling, we know that symptomatically they will feel better. We know that they'll have less infections. We know they'll do less damage. We'll know that will slow down the damage of the lung if they stop smoking. So even if an 85-year-old can stop smoking and benefit, imagine all the younger people will benefit for much longer.
Okay. As the weather is changing, let me introduce our listeners as well. So listeners, if you have any questions or queries regarding our show tonight, please get in touch with us by calling us on 01582 481822, or you can send text messages or WhatsApp on 07779 481822. We are talking about lungs health, and definitely we will be talking about the changing weather. And when we talk about changing weather, one of the very common things which happen is the when the changes, people do get ill and they do get infections and so forth. So people who I've completely forgot to ask you one thing. So people who already have established conditions like asthma or COPD, and they were an ex-smoker, will they be offered the same?
If they fall between the age of 55 and 75, they will still be offered the same. But as I was trying to reiterate, if you still get symptoms where your breathlessness is getting worse, where you're coughing persisting more than 6 weeks, or where you're coughing up blood, sudden weight loss for no reason, go and see your doctor. You don't have to be on the program to get investigated. Okay, but particularly if you're asymptomatic, you're feeling well, you will get a letter over the next 2 years. So we're doing it very gradually because of the numbers. But over the next 2 years, it's a 4-year project. So 2 years, we hope to get everyone through. What I want to try and show is that Luton stands out, because all the previous pilots have only been 50% of people taken out. I want that number to be much bigger, so that everyone has the benefit from that.
Okay. In terms of as we know, the cold weather is settling in. We have cold day by day, so people do have coughing and infections in their lungs, anyways, due to the coldness of the weather. So people who already have asthma or COPD, what are the advices for you from you?
So I guess the first advice is the same for everyone: is try and stay as healthy as we can, eat healthy, exercise, don't smoke. Those 3 things I'll keep repeating and repeating because people are still doing it. It's interesting when you look at the world when they have their flu epidemics, it's always around celebrations and holidays, and it's almost certainly is because that's when we eat our most and worst things. It's when people drink and smoke. It's when people gather in big parties in houses, don't go outside as much, don't get the fresh air, spreading it amongst each other. And you can plot it. You can plot where the flu vaccine is. So, if you're going to a country where you're having a big celebration, if you avoid it, you're less likely to get the flu. But joking aside, you can avoid by staying healthy, eating less, and things like that. For those who already got conditions, asthma and COPD, you still treat it exactly the same. Most infections are viruses, and viruses don't respond to antibiotics. With the weather now changing, people are now coming in with their coughs and colds, and we're seeing lots of it. People are still worried that they need something. Unfortunately, your body tries to protect itself by producing mucus, and to stop the mucus collecting in your lungs, you're going to get a cough. So the mucus and cough are your normal protection. We can't stop that, and we shouldn't stop that, because that's helping you. Most people are going to be unwell for about 4 or 5 days. Mild temperature, which you can take paracetamol for, ibuprofen for those who can take it. And 4 or 5 days, you'll feel at your worst. You may need to stay in, but drink plenty. Keep moving. Try not to just stay in bed. You want to exercise your lungs to help it clear things, and then you should start to improve. Now, the cough unfortunately forgets to switch off because it's designed to stop phlegm collecting in your lungs and getting pneumonia. So the cough can last for 7 to 14 days. So people always worry about the cough, and they come, and there's very little. All the research have suggested the cough mixtures don't work. So unless you're very short of breath and the coughing is that drastic where you're finding it difficult to breathe normally, then we should see you and assess you. But otherwise, let nature take its course. It will eventually clear by itself. If, however, you're high temperature, shivering, coughing up lots of green phlegm, becoming more and more short of breath, and you're getting worse, then you need to seek help. And I would suggest ring 111. Most practices now in Luton, because of the access problems and people, we've listened to people. If you ring 111, most practices will have their emergency appointments that can be booked directly by 111. So they can ask all the relevant questions to see whether the person needs to be seen, or just have general advice like I've just given. If they need to be seen, they will book them into the GP practices direct.
Either their own or the general one?
Well, mainly on their own, but out of hours, it will be the out of hours services that are available.
And in terms of, sorry.
Yeah, so with the asthma and COPD, if you've got asthma and COPD, you've got to know what to do if you're not improving with the virus. So for asthmatics, if you're becoming more breathless and more wheezy, push up your blue inhalers. That should be automatic. I'm still seeing people who come through our asthma clinic who still aren't doing that. They use their 2 puffs or hardly use. It's okay. I know we scare people by saying don't use your blue inhalers that often, but it's there when it's needed. So if you're finding you're a bit more wheezy than normal, push up your blue inhalers to 2 puffs. Make sure you're using it correctly. Make sure you've had your asthma check, and make sure you know what to do when these things happen. But push up your blue inhalers to up to 4 puffs to 6 puffs. If you're needing 10 puffs, it normally means you need to be seen. So again, ring 111 or your surgery to be seen. But you can go right up to 10 puffs. If you're needing that every 4 hours, you need to be seen. So if in a day or 2 you're still not beginning to improve, you need to be seen. We try and give out peak flows to show how fast you can blow out. Now, you should know if you're an asthmatic, you should have a peak flow at home, and you should know what your best is. Now, if you're less than 50% of your best peak flow, so someone like myself will be about 600, some people are on 500, but if I'm normally at 600 and my peak flow is now suddenly 300, then I need to push up my blue inhalers. If that's not helping, then I need to seek help. If your normal peak flow is around 300 and it goes down to 150 and you've used your blue inhalers, it's not working, seek help. And then also, if over that time you may need to start using a preventer inhaler if you're not on it already. Most people should be on their preventer, and that should be your mainstay so things like Clenil, Foster, things like that. For your COPD patients, so make sure you've had your asthma check, because your asthma nurse should go through these things, and they should give you an asthma plan that tells you exactly what to do when you're not feeling well, and how to recognise when your asthma is not well controlled, and also what to do when it's acutely unwell. For your COPD patients, they're a slightly different beast, because most asthmatics, it's a virus infection that makes them worse and don't often need antibiotics. For your COPD patients, if your phlegm is increased in volume or it's turned different colour, or if you're more short of breath than normal and the inhalers aren't helping, that is what we call an exacerbation. You probably need antibiotics and steroids at that stage. And the earlier you can have that for a COPD patient, the better, because there's less damage. Asthma is reversible, so you don't need to worry so much about how early. It's more about whether you're responding to the inhalers. Whereas COPD, if your phlegm is increasing, if it's discoloured, and you're getting more short of breath, you've got an exacerbation. Now, if you've had exacerbations in the past, 1 or 2 a year, most practices will give you what we call an anticipatory emergency pack.
Sorry, so exacerbation means?
Exacerbation is your phlegm increased more than usual, the volume, the colour is discoloured badly, so it's darker green, and if you're more short of breath than you usually are, and your inhalers aren't working for that, that's what we call an exacerbation. So those people need antibiotics and steroids. For those who keep having these things, it's best to have one at home. So if in the middle of the night these things are happening and you can start it straight away.
So you're saying something about anticipatory medicine?
That's those steroids and antibiotics to be kept at home.
Okay.
So that's what we call anticipatory drugs. So those with COPD should know that. If they don't, then, and you don't have, and check your cupboards, make sure they're in date. It's surprising. They do have long shelf lives, a couple of years, but most people don't look at it. Just go in, and if you've had it for a year or two, just have a look and make sure it's still in date. Because that will, if you start to get these symptoms, shortness of breath, increased phlegm, discoloured phlegm, you can start it straight away and then inform your doctors that you've started, so we can send you another pack. And then if you're using it 2 or 3 times, we know you probably need to be assessed and whether we need to refer you to hospital and so forth. So make sure, if you've got COPD and you've had previous infections, have a discussion with your doctor whether it'd be appropriate for you to have emergency pack of steroids and antibiotics at home.
So, is there any support groups available for patients like these who have these kind of problems?
Obviously, you've got your friends and family. Locally, we have Breathe Easy, which, if you don't mind, I'll look on my phone to get the number.
Yeah.
But it's mainly for people with chronic lung disease, mainly adults, and they meet regularly once a month at. I'll tell you exactly where in 2 seconds. So it's, because I can never say it. Right, the Pavilion, Skimpot Road, Dunstable, behind Tesco's.
The big Tesco's in Dunstable. Yeah.
So they meet there every second Thursday. So the next one's 9th of January. The one after that is the 13th of February. So every second Thursday between 2 and 4, and it's like a support group, and it's much better to meet with people who have similar conditions, because most of these will be experts in their own conditions, and often more expert than the doctors and nurses that look after them. They know their condition, they share ideas, they share how to avoid illnesses or what you're entitled to, what things you can claim for and things like that. And they always have a speaker. It's a very good social, sharing ideas and concerns.
In fact, on 9th of January, they have somebody from the Smoking Sensation talking about smoking as well. Yeah,
they're a fantastic group. The ethnic groups aren't well represented, and we don't know why that is. They've tried to reach out. We don't know whether it's because of where it is or not, but it'd be good for people to start going. I think they take carers as well, so that when I've encouraged people to go to these groups, it's the fact that when they're not sure about something, they feel free to ask these people, and they normally know. So, for example, they go on trips. So someone with severe COPD may find it difficult to think about going on holiday and things like that. Well, they do trips, and they have wheelchairs, and they have people to help, things like that. So it's a really good group to be involved with. If you want the number, I'll read out the number for you. Yeah. It's 03000 030 555. 03000 030 555.
Okay. And sir, in terms of the flu vaccinations and pneumococcal vaccinations for people who already have chronic disease, lung disease like COPD or asthma, what is your advice? Because flu season lasted between September to February. But
we are very poor in Luton to have our vaccinations. There's all sorts of myths going around. People are really worried about what the side effects might be, yet there's people dying because they're getting flu. You've got to think of flu, although I said that it doesn't respond to antibiotics, but when you've got COPD or chronic lung disease or any other chronic disease like heart disease, strokes, diabetes, pregnant women, for example, children under 5, those people, their immune system, like we talked about earlier, about like your army is like your immune system. If your army is having to fight the flu, it's being distracted and bacteria get in through the back door. And there's myriads of research now suggesting that lives are saved. People aren't getting admitted to hospital because of the flu vaccine. If you're a carer, you're entitled to free flu vaccination. So if you've got someone with chronic lung disease or chronic any disease really, and you're their carer, you can get the flu vaccination. We've tried in Luton to make it as easily accessible as possible. Practices have got clinics running all the time. You can almost walk in and they'll book you in with the flu clinic. Pharmacists are doing vaccinations, so you can go to your local pharmacist and most of them are doing vaccinations. Yet in Luton our numbers are still below the national average. I can't explain why. I think it's I don't know if there's a rumour going around how bad that it's not good for you or what.
Well, it helped me in person, I must say.
But it does stop people going into hospital, because if you can stop the major flus that are likely to come, and there's hundreds and hundreds of different flus, it doesn't stop every flu. So you can still get a type of flu, but the one that's going to end up putting you in hospital is the one that it tries to prevent. And success rates are there. So I encourage everyone who has any of the chronic diseases, and that also includes over 65. So anyone over 65 should be getting their flu vaccinated, and you can still get it. So go to your pharmacist, go to your general practice, and get your flu vaccine. If you're a carer, you don't want to be giving your flu to someone who's chronically ill, because they'll get ill very quickly.
Definitely. And on that note, sir, thank you so much for enlightening us with all these positive messages.
Low CT emission, it just means it's far less radiation, so it's much safer than a full-blown CT. Someone asked the question earlier.
Yeah, and on that note, I must say thank you so much, sir, for coming today.
Excellent.
And I will be definitely calling you again, because
Park run Saturdays, 9 o'clock.
Yes, definitely. I will be joining in, inshallah, in the park run as well this Saturday, myself as well. Try to beat you this time. Nah, I can't, because you run really fast. Anyhow, until next week, I'm saying Assalamu alaikum. Thank you so much, sir. Assalamu alaikum.
Walaikum salam.
Thank you for listening to our podcast. We stream our daily broadcast on inspirefm.org. You'll find all our daily updates on our social media at Inspire FM Luton.